All right, so we're going to begin with this paper here, and it's one of the really early papers that, well, I shouldn't say early papers, one of the better papers that talk about both sides of the response that we're really concerned with here when we're talking about skeletal muscle adaptations in response to exercise. And we typically, again, think about exercise as being this: you do this exercise and you see positive benefits and all of those things. But we also have to think about the removal of exercise, not just the addition of it. And that tends to be just as big, if not more important, when you start talking about the general population as a whole. Because we've got a variety of conditions like sarcopenia, just general aging. We see some conditions where we see in response to cancer, in response to AIDS, profound skeletal muscle atrophy. We'll see it with disuse if someone gets put on bed rest because of various reasons. We're going to see it in athletic populations. You start talking about someone with a major injury where they've now laid up for a given period of time, whether that be due to concussion, that be due to back injuries, and that was kind of a big area, the athletic detraining side of things, in the 80s and 90s, and it's starting to come back now that we're starting to realize that maybe a couple days rest is not sufficient in some of these conditions. So that's where this paper gets real exciting, because you start looking at not really the time course, but what are some of the early changes. And if you looked at the paper or the PowerPoint, you'll notice that we're talking about 8 weeks of training and 8 weeks of detraining. And 8 weeks of training is pretty darn acute, especially when you're talking about skeletal muscle adaptations. But 8 weeks of detraining, that's very feasible. That's something we could see in an aged population that's put on bed rest because of a knee injury or hip injury, or an athlete with a major injury. So this is getting at some of the signaling that comes into play, and then with that signaling, they kind of bring up in the paper, how could we maybe target some of these specific integration points to try and prevent or augment some of these responses. So title, AKT signaling through the GSK3 beta, mTOR, and FOXO. It's involved in human skeletal muscle hypertrophy and atrophy. And it's a 2006 paper out of the Journal of Physiology, which is a great journal that a lot of us work out of and publish in. So just a little bit of background. We know, we've harped on it, human skeletal muscle hypertrophy occurs with an increase in functional demand as seen with assistance training. And I bring this figure up here because I find it's really important that if we look at performance as a function of time with a marker of about 6 weeks, and this study we're really looking at here is 8 weeks, so just not much further, we can start seeing changes in strength, and that's usually early adaptations is neural, so we're not getting into that, but then we start seeing the hypertrophy start to go up about 6 weeks. So what we're really dealing with in this particular paper are some of the very early changes. And if we then went out to 10, 12 weeks, we start seeing more. Now, again, if you've done or participated in any type of training program or training research, 8 weeks is a long time. An 8-week training study that has 10 people in it can take you upwards to 3 years to collect. And if you're talking about a 10 to 12-week study, you could take up to 5 years to collect that data, just because of people dropping out and just trying to convince someone to do it. Because in studies like this, it needs to be highly controlled. It's not just go start doing some sort of exercise and we'll see in 8 weeks. It's usually very supervised, very programmed, like you would see in a rehab center, because you want to be able to make sure that it minimizes the variability. So that's something to keep in mind. But this is the general hypertrophy response. Skeletal muscle atrophy, very devastating. We see it with trauma, catabolic diseases, cancer, diabetes, sepsis, AIDS, denervation, and sarcopenia, neuromuscular disorders, ALS, critical illness, and the classic is just a function of age. So this isn't everybody, this is everybody. Percent muscle mass is a function of age, 20 years of age and on. So those of us beyond 20, we're basically screwed at this point. So it comes into play for all of us. So let's just review quickly, and this is why I chose these couple papers, is because they do review topics that we talked about in class. So we've got resistance exercise, strength-related type of exercise. the signaling pathway, one of the primaries is through IGF-1 receptors. We have our IRS docking protein, the PI3K, and eventual phosphorylation of AKT. And if you remember that AKT can do a variety of things, and we primarily talked about this on your right, where it phosphorylates mTOR, or through this series of processes that I took out here in the TSC 1 and 2 step, just kind of make life easier on this figure here. But through an additional step, we get eventual phosphorylation of mTOR. That activates PS70SK6, and we didn't talk about this in detail in class, but it comes up in a lot of papers, particularly this one, so I bring it up here. But we did talk about this particular pathway where we get phosphorylation of 4-UBP1, and I should have 4 little phosphate groups on there, but I don't. That removes its inhibition and promotes this initiating factor 4E, gives us improved protein synthesis and translation. The other pathway that's brought up in this talk, but we don't really focus on in lecture, I tried with lecture to just kind of highlight the key points, not get into every single pathway. But we know if we activate and phosphorylate AKT through a series of events that we're going to get this glycogen synthase kinase 3 beta, so GSK3 beta. It gets phosphorylated, removes its inhibition of another initiating factor, so translation initiating factor 2B. Again, so we can remove the inhibition, allow this initiating factor, that IF tells us that's what it is, we get promotion of protein synthesis. So that's one half of the equation that we need to improve the synthesis. We also need to maybe, and this was at the time when they were getting into this paper, what is the side of protein degradation? Is there something about resistance exercise or the removal of resistance exercise, like you'd see with atrophy? Is that promoting or demoting the ubiquitin proteasome pathway of protein degradation? So if we see some downregulation, where's my mouse? Here now. There we go. If we get some downregulation, so we remove our stimulus, therefore we dephosphorylate or inactivate our AKT molecule. Once we've done that, it removes this inhibition of this fork head FOXO. This FOXO allows it to translocate to the nucleus, promotes transcription of E3 ligases like MRF1. If you remember back again to one of our early lectures, we have to have these E3 ligases as part of the ubiquitin proteasome degradation of proteins. That's going to give us atrophy. So if we turn off AKT, we're going to promote degradation. So to kind of look at how these two separate pathways, one in promoting protein synthesis and one promoting protein degradation, how those are involved in normal human processes, this study came into play. And up to this point, a lot had been done in animals. And as you can expect, while we can gain a great deal of information from animal-related research, at some point you have to make that translation into human-related work. So 25 male volunteers, which is a great sample size for this type of study, physically active, but no prior resistance training for more than 12 months. And they did a variety of tests, VO2 max, strength, muscle biopsies. And I'll show a couple of that data just so you can kind of put it into context. They did 8 weeks of resistance exercise and then stopped that and did 8 weeks of inactivity. And they took biopsies in between, at the end of the resistance exercise and after 8 weeks of inactivity. And this is kind of the biopsy procedure. So, usually you do a little bit of lidocaine. You then, from a variety of different techniques, you take this little tiny needle. Well, I shouldn't say tiny needle. It's pretty decent size if you're the one getting stuck. Stick it into your thigh, usually the vastus lateralis, rectus femoris. Sometimes you'll see the gastroc. Try to get mixed muscle fiber types, and you can come out, and there's your little hunk of skeletal muscle. So there is a limitation to some of this. So you can't take everything as just straight gold, because that's a pretty small fraction of the entire skeletal muscle. So you're assuming that everything you see here represents the entire muscle. And if you're talking about mixed fiber types, that comes into play as well, as what type of fibers did you actually biopsy. Training protocol, 2 days per week for the first 4 weeks, 3 days per week for the final 4 weeks, leg press, squat, leg extension. This is another thing to keep in consideration if this is like an area you're interested in. This is fairly mild. This is what a recreationally active individual would progress through. It's not what you would see in an athlete, and it may be a little bit more or roughly the same as what you'd see in a rehab setting. So you can then take it as, okay, that's that type of training. If this is what a normally recreationally active individual, say you've got a 70-year-old individual, this is probably what they're doing if they're going to the rec or the YMCA. Well, now you've removed a very standard, normal type of exercise if they become injured. So that's a nice thing about this. It's not a massive stimulus, but it's a stimulus you'd see most people experience. So let's look at some of the results. Did the training have the physiological outcome it was supposed to? And this is critical. Did they see actual functional changes? And if we look, this is pre-training and post-training with maximal strength, leg press, extension. We see nice increases in leg extension and squat. Endurance, which we're not getting into the details of how they define those two, but endurance, leg extension, leg press, squat, all see nice improvements. And we're talking 20 to 15% increases in strength and squat respectively, no change in maximal strength. Let's see, can I highlight this stuff? Here we go. So we can highlight some of this. Make nice questions. So the training did as it was supposed to. What about the detraining side of things? So this is change from pre-training in quadricep size. So here they quantified actual skeletal muscles mass, because again, they're looking at pathways known with hypertrophy. So that's where it gets difficult. Are you talking structural or functional? This would be a more structural thing. So we see a nice increase in about a 10% increase in quadricep size following post-training. So that's what we've got here. Like that. And then after 8 weeks of detraining, we see about a 5% decrease. So this is interesting in my mind because 0 would be what you were prior to any exercise. So they did 8 weeks of training, you saw a 10% increase. They then took all exercise away for 8 weeks, and it decreased, but it didn't go back down to what you were. So the rate of detraining for muscle hypertrophy is actually a little bit slow in this study. You still had some hypertrophy relative to how you came in at the very beginning. It's 8 weeks, but they did see atrophy, so there should be some sort of signaling driving this atrophy. Yeah.
So if do you know if there's ever been like research done on like this I guess the same concept, except that if another group had gone under more rigorous training and had a greater increase, say like 15% increase, if they would both show about the same rate, or like a more highly trained muscle would be slower?
It's actually the opposite of that. So typically, if you take someone who's really well trained and you detrain them, they see massive drops compared to someone who is only mildly trained. We see this in the astronauts a lot. So if you've got just a rock star on Earth and you send them up for 6 months, they're going to see big changes. Now, they'll still likely be fitter and stronger than some of the other astronauts, but they still see a greater percent decline. If you take a couch potato and make them just a little bit more of a couch potato, they really don't see much response. So that is something to take into consideration with this, is that, if we took some really trained, they've been training for a year or two, and then had them do 8 weeks, it's very likely they'd see a greater drop. Good question. All things to kind of keep in mind when you're trying to interpret data. So, given that this AKT molecule is a key integrator of both skeletal muscle protein synthesis and protein degradation, let's start there. So this is AKT phosphorylation. We can look at it pre-training, post-training, and as we'd expect, we see a nice big increase post-training. So through those signaling pathways, whatever it may be, AKT became phosphorylated, and it turns out it's about a 1.4-fold increase. And that after 8 weeks of detraining, it comes down, still elevated compared to pre-training, but definitely if we remove the training stimulus, the level of phosphorylation of AKT is reduced, and by up to about 33%. This really mirrors what we saw with skeletal muscle hypertrophy. Well, given that AKT can do a variety of things, we can't really stop here. We want to know what's the next step, because just knowing this doesn't tell us, is it synthesis or degradation? So this top middle figure, this is just the AKT from the prior slide. So here's our GSK3 beta. So if you don't need to back up. I'm just going to put things into perspective. So that is this step here. With training, it becomes phosphorylated. So it goes up like so. With detraining, comes back down. So phosphorylated GSK3 beta, downstream target of AKT, increased by about 42%, decreased then by 33% following training periods. That's almost identical to what we saw with AKT phosphorylation. So logically makes some sense. What about mTOR? Also a target, even though it's a step because there would be the TSC 1 and 2. It's a step here. We see mTOR elevated with training. And here's where it gets a little bit interesting, is that post-training, despite removing the training stimulus, mTOR remained elevated. So I'm not going to highlight all of these, but I'm just going to put off to the side so you know. Phosphorylated mTOR is another downstream target of AKT, increased by 44% following training, and remained elevated after detraining. And this is kind of interesting and a little bit difficult to interpret. And one reason could be that it becomes active, it's active longer. And the other thing is remember, we didn't reduce or lose all of the atrophy. It was still elevated relative to pre-values. So maybe there's some latency issues with mTOR that it doesn't take 8 weeks for it to start going back down. It may be a little bit longer period. But there's also other things that simulate mTOR, so it's a little bit of an open box. So following 8 weeks of resistance training, this is just our nice overview slide. We know that we see increases in AKT, increases in 3-beta, or 3SK3 beta and mTOR, all that should promote protein synthesis and translation initiation. If we remove that stimulus, so with our detraining of 8 weeks, based off these findings, we start seeing decreases in AKT signaling, decreases in this GSK3 beta, which again would decrease our level of protein synthesis and translation initiation. mTOR stays elevated, so it doesn't appear to be as affected with detraining as some of these other pathways. What about the protein degradation side of things? So again, this is our AKT, but remember AKT also impacts FOXO, so I'm just going to back up real quick here. Remember, If we remove phosphorylation of AKT, that should promote FOXO, and through this give us our E3 ligases. So what we see that with training, AKT goes up. So as it becomes phosphorylated, it should inhibit this FOXO1. So we see this drop in FOXO. So that should be removal of the stimulus and the signaling for E3 ligases that would cause protein degradation. So reduced by 33% post-training. And it kind of goes up a little bit. They like to say it's a tendency, but that's not much of a tendency. Say it starts to go up much, but for the most part, when they detrained within that 8 weeks of period, and this is again normal, just removal of the exercise. They still walked around, do normal activities. The signaling for protein degradation through FOXO really didn't change much. So what we see, just as our summary slide, exercise, resistance exercise, we get an increase in AKT that's also associated with a decrease in the FOXO that we know will increase atrophy signaling genes in both animals and cell culture. So at least this was what we know from response to exercise, that the level of protein degradation appears to be turned off. And 8 weeks of detraining may not be really enough to really turn things back on. So in summary, this paper establishes a role for AKT signaling in both human skeletal muscle hypertrophy and atrophy. So it's pretty clear that that is integrating some information on both sides of the coin. During muscle hypertrophy, induced by resistance training, we see the activities of AKT and its downstream targets of GSK3 beta and mTOR are increased, while the activity of the atrophy signaling factor was decreased. So things you would expect to occur to promote skeletal muscle hypertrophy. The response of these hypertrophy and atrophy targets were a little bit inverse after a period of atrophy-induced detraining when compared to the post-training levels. They weren't mirrored, and that's been a real challenge. It's still a real challenge of really what is driving skeletal muscle atrophy. As such, we don't see a lot of research these days on factors driving hypertrophy. We've got that pretty well figured out, unless it's new areas of training or pharmacological agents, but just standard regular exercise we got a pretty good feel on. But when it comes to atrophy, it's pretty much an open box with a little bit of controversy thrown in there. Questions about this paper? Kind of just highlight some of the work that really drove the things we learned and talked about in lecture. All right. Come on now. So the next paper unfortunately, we have to transition a little bit to the mouse model. This is one of the earlier papers highlighting, and we actually showed some of this data in class class period, about how AMPK, so AMP activated protein kinase, how it suppresses protein synthesis in rat skeletal muscle through the downregulation of mTOR. And again, we showed a little bit of this data, so I'm just going to go into a little bit more detail with this here and hopefully reinforce some of the things we talked about in lecture. So a little background here, again, this is one of the earlier papers, so they like to highlight some of the key things that we know and don't know. AMPK, it's energy sensing, signaling protein within the cell, responds to a variety of changes, particularly ratio of ATP to AMP, as well as PCR to creatine levels. Let's see if I can get a highlighter again here. So this is an important point. So what are some of the things that would drive an increase in AMPK? And what are some of the things that we know about AMPK? Well, we know it's going to increase glucose uptake. We know it's going to increase fatty acid oxidation, GLUT4. We know it's going to activate PGC1 alpha. So a variety of things that we know are going to be positively influenced through AMPK. The question these individuals had, again, driving back to some of these observational things that were made, is how is this energy sensing signaling protein related to mTOR signaling? We know mTOR, animal models and other experiments, is driving skeletal muscle adaptation. And if AMPK we know is driving other types of adaptation with skeletal muscle, what's the interaction? And they hypothesized, through some of the work, that AKT is definitely going to be a key role here because, again, we just talked about it. It drives initiation through this GSK3 beta process. We know it's going to drive it through the mTOR process. And we can see some of these end effects here. So here's our 4-EBP1 phosphorylation. So this would be a key step that we would expect to occur if we can phosphorylate AKT. It's going to promote initiation and translation, but it's going to replace it on the side of resistance training. We know here's our IF2 beta initiating factor. That's going to be right here, IF2 beta. So we can kind of see how these two end steps here play a role in the initiation and elongation process with translation. So the method's pretty straightforward. They use this subcutaneous injection of AICAR. Within a couple hours, we know that a variety of things, particularly we're going to see this increase in AMPK. And typically with endurance type exercise, we're going to see this change in AMP to ATP ratio, and that's going to stimulate AMPK. And here's just a non-exercise means in which you can stimulate AMPK. So it kind of took out the dirtiness that comes with exercise as a training or as a method of stimulating AMPK, much more controlled. And then they looked at a variety of molecular markers. They looked at AMPK activation, 4-EBP1, SK61, AKT, which they will call at this time still protein kinase B, and mTOR. So they looked at these steps that we talk about here. They talk about AKT, they talk about mTOR, IF2B, SK6, IF4E. They're looking at all of those steps. So what are the effects of this drug on AMPK? Again, we talked about this in the lecture. There's two subunits or isoforms of AMPK, an alpha-1 and alpha-2. And if you really dive into the literature, alpha-2 is the one that seems to be more stimulated in response to changes in metabolism or metabolic activity. So it's the one you'd expect to be activated with exercise. And as we see here, our drug gives us an increased AMPK activity within this alpha-2 isoform. So that's the first thing with any one of these studies. Make sure your drug you give actually does what it's supposed to do. All right. For these guys, they didn't really look at long-term adaptations. They did the next best thing and looked at what's the change on protein synthesis. Protein synthesis, if you can change that, that's going to give you the long-term adaptations. And we can see here's muscle protein synthesis under control on our drug animals, and we can see nearly a 50%, almost 60% drop in muscle protein synthesis in these treated rats. So there's not been any exercise. All they've done is activate AMPK and had a profound impact on protein synthesis. Thinking about the signaling pathway, what's driving protein synthesis? What are the initiating factors that would be coming into play? If you link back to that figure, 4EBP1, SK61 are kind of in steps, things that are going to drive that initiation of the translation and therefore give us our protein synthesis. And we can see here significant reductions in the animals that had an increased AMPK activity. And in some cases, that's a pretty profound drop. You know, this is only about 15, 20%. This is a pretty extreme drop. So I'm not going to read these word for word, but you know, these are nice points to highlight. In muscle treated, we see a decrease in 4EBP1, so it's not phosphorylated, therefore it's not allowing the initiating factor to do its job. Same thing here. And this suggests that phosphorylation activity of mTOR is also going to be repressed. These are downstream targets of mTOR. And if we look at those, that actually is the case. So again, they use a little bit of odd terminology here. So up here is AKT, here's mTOR. So you can just write that off to the side of these. They're just looking at particular proteins along, or amino acids, I should say, along those molecules. But we can see AKT severely downgraded. mTOR activity is severely reduced, all because they've activated an increased AMPK. So summarizing this, this work was some of the real early work that told us that, well, if you increase AMPK, you're going to get a decrease in AKT molecules. They showed that. You're going to see a decrease in mTOR phosphorylation. Therefore, you're going to see a decrease in 4EBP1, SK6, IF2B. Put that into frame down here. This doesn't happen. This doesn't happen, and therefore this doesn't happen, and we see reduced protein synthesis all through this one molecule. And this really set up again why we see this and think this concurrent exercise paradigm becomes really interesting, that endurance exercise might prevent or inhibit some of the signaling associated with resistance exercise and therefore not give us all the adaptations we want. So in summary, provides the first in vivo evidence that AMPK activation directly affects translational initiation and protein synthesis, mediated through mTOR signaling. Further established AMPK is a unique energy sensing sensor that not only modulates things like GLUT4 translocation and PGC1 alpha activation, but also appears to regulate some of the anabolic functions of mRNA translation, particularly those that we know occur with resistance exercise. So pretty interesting that we've got this one molecule that has such broad regulation within skeletal muscle. Questions about this paper? All right, so let's get out of this real quick. It'll let me. So as this is getting out, we can kind of go over what's going to be on the exam. Standard format is the last two. Come on now. Standard format is the last two. True and false multiple choice. It will be Scantron. As I've mentioned a couple times in class thus far, I'm not going to make you pull